Arthur Gianelli is the Chief Transformation Officer for the Mount Sinai Health System and President of Mount Sinai Morningside. As Chief Transformation Officer, Art partners with leaders across the Mount Sinai Health System to transform organizational culture, implement best practices, and instill key behaviors to drive improvements in patient experience. Efforts to transform organizational culture includes launching a series of learning academies and spreading the utilization of Lean across the Mount Sinai Health System. During his tenure as president of Mount Sinai Morningside, Art introduced a Lean daily management system, which has driven significant improvements in patient experience, quality, and safety measures. He shepherded a transformative capital improvement plan and grew many service line programs. From 2006 through 2014, Art served as President and Chief Executive Officer of New Health, a public benefit corporation that runs the Nassau University Medical Center, a nursing home, and co-operates the Long Island FQHC. Under Art's leadership, New Health earned accolades for stabilizing its finances, improving quality of care and patient outcomes, and modernizing and expanding its services and facilities. Prior to joining New Health, he held senior executive positions over a 10-year period for 2 local governments in Long Island. He was Deputy County Executive for Budget and Finance for Nassau County and Director of Operations for the town of North Hempstead. He was responsible for shepherding many fiscal turnarounds in both municipalities. The Healthcare Leaders of New York is proud to honor Art with the 2021 Award of Distinction. That is HLNY's highest recognition to a healthcare executive that has demonstrated sustained and outstanding contribution to the advancement of healthcare administration as a profession. Art's impact to the next generation of executives is evident by his commitment to mentoring and grooming the next generation of healthcare leaders. Congratulations, Art. We are here today at Mount Sinai Morningside with Art Gianelli, Healthcare Leaders of New York's 2021 Award of Distinction recipient. Art, I'm thrilled you agreed to this Fireside Chat to connect with our members by sharing about your life stories and career progression as an inspiration and encouragement to us all. Thank you.
So thank you, Sam, and thank you to the members of HLNY for this recognition. I'm really humbled. As you know, I didn't start my career in healthcare, so to be at a point where I've been a hospital executive for almost 15 years, and to receive this recognition from my peers, it's really remarkable, and again, it's really humbling.
I would like to start off with some of the earlier years, and just if you could share a little bit about your upbringing and some of the values that were instilled in you at an early age that helped shape who you are today.
Sure. So I was born in Jamaica, New York. At the age of 2, my parents moved me and my brother out to Long Island, and we grew up in Mineola. We were kind of like a real middle class family. My father was a college professor. My mother was a nurse, and so they instilled in me the value of hard work. The value of really knowing your subject matter, being an expert at what you do, the value in being kind and considerate, the value of paying it forward, the value of caring not just about yourself, but the people in the world around you, and trying to leave your part of the world just a little bit better than you inherited it.
That's awesome. And I experienced those same values when I first met you. I think I came up and introduced myself to you, and you were quite warm and welcoming, and you treated me as a peer, even though I was fairly young at that time. So those really do come through. In your younger years, were there any childhood heroes that you looked up to?
So, of course, I looked up to my mother and my father. My mother recently passed away. She was an extraordinary nurse. Caring. She would give her all for her patients, and she would fight fiercely for what she believed in. My father, an extraordinary college professor for 40 years, gifted teacher, true mentor, and somebody who's really thoughtful about not just his work, but but the world. And I learned a lot and continue to look up to him each and every day as well. Beyond my parents, I think as I was growing up, my heroes were sort of some of the classic heroes. President Kennedy, Martin Luther King, just as two examples. Because these were extraordinary figures in history who helped to shape the course of history for all of us here who live in the United States. And I felt very strongly that what I wanted to do was contribute in some way, either in the public sector or in the private sector, but I wanted to contribute in some way to the betterment of people and to make a difference in their lives. And I think the people that I looked up to when I was growing up really instilled that desire in me as I was growing up.
So are there any life lessons that you've learned in your earlier years that you carry forward today at your work?
So there are a couple of life lessons that I clearly learned as a child that I know I bring to my work each and every day. I think the first life lesson is that if you're good to people, goodness will come back to you. The idea is you want to treat the people you work with, your colleagues, your bosses, the people who work for you. You want to treat them as you would want to be treated. You want to treat them well. You want to treat them with kindness. You want to encourage their life aspirations. You want to support their goals for their lives, both professionally and personally. And I learned that from my parents because my parents each and every day were encouraging me to be the best that I could be, to aspire for anything that I wanted to aspire to, and they were supportive of me every step of the way. So that's number one. Number two, it's the importance of knowing the work you do, to really learn your craft and make learning a lifelong endeavor. Again, my father was a college professor. And I learned from him the value of being knowledgeable, not just in your area of focus, but being as knowledgeable in as many other areas as possible. You want to have a breadth of knowledge as well as a depth of knowledge. And in my particular case, when I started my journey as a healthcare executive, again, I didn't start in healthcare, so I was coming brand new to this incredibly challenging field. And what I told myself is, what? I'm going to learn as much as I can, and I'm going to get as smart as I can in this field because that's the way that I'm going to make a difference, not just to the people that work with me and for me, but also to the patients who are coming to the hospitals that I run and entrusting our hospital with their care.
That brings me right on to my next question. I know you mentioned that you didn't start in healthcare. So I remember hearing some stories about the risks and some of the opportunities that were presented to you. And because you took some of those opportunities, you are where you are today. Can you share some of those stories with us?
Sure. So my career, it really went in a very different path than many. I graduated with a degree in history from St. John's University back in 1991, and I decided that what I wanted to do then is that I wanted to go into a career in academia, and I wanted to teach political science, much like my father taught philosophy, as I said, for 40 some odd years. So I went to graduate school at Brown University and was enrolled in a really intensive program in political science and public policy, learned a ton. In fact, I would actually make an argument that I draw the most upon my degree in political science. Even though I have a degree in business and I have a degree in public health, I draw the most every day from my degree in political science, believe it or not. So I got my master's degree in political science, but I ultimately concluded that, I don't want to teach yet. I want to get involved in doing work and helping people. So I came back to Long Island, and one thing led to another. I volunteered on a number of local races for mayor and for town supervisor, and I ultimately worked for the supervisor of the town of North Hempstead, who was an absolutely brilliant woman who was introducing legislation that was literally decades ahead of its time, whether you're talking about preserving our environment or preserving our drinking water or advancing the rights of women. She was introducing that sort of legislation years before any of those issues were fashionable. But what she wasn't was a great administrator. And she'd be the first one to say that were she here today. And her deputy left the administration, and it left a void. And I decided, and I was in my mid-20s, and I decided, I said, you know what? I can do that job. Now, in retrospect, being a little bit older, when I look back, I'm thinking, what, were you nuts? But, you know, it was the right thing for me to do from a career perspective. I walked into the town supervisor's office and said, I can do that job. And thankfully, she said yes, because that answer really was the beginning of my career as a manager, as an administrator, as an executive, as a leader. I took on that role, which was essentially the top appointed administrative official for the town. I know I made myriad mistakes, but I also learned a lot, and I did a lot of good. And from there, I was asked to be the deputy county executive in Nassau County for budget and finance and put together a turnaround plan for the county, which was at the time rated the worst run county in the United States. And so I had to do a considerable amount of turnaround work. I put a team together to get that work done. We worked 90 days straight like we were consultants, working at 2 or 3 o'clock in the morning, but we put an extraordinary plan together. It led to the county getting all sorts of credit rating increases, us introducing any number of best practices, and really making a difference in turning the finances of the county around. After I'd done that work, I said, you know what, I'm going to go to the private sector now, and I'm going to work for a consulting firm in public finance, and that was sort of my background then. And consultants that the county had hired to help it in its relationship with a public hospital, its affiliated public hospital, the consultants came to me and said, you know what, we want you to consider running the public hospital. My initial reaction was to laugh because I had never run a hospital, and this particular hospital was always challenged. It was challenged politically, it was challenged operationally, it was challenged financially, it was challenged clinically. And everybody who had been in the position of being the president and CEO of this hospital, you know, they left under not so great circumstances. So my initial reaction was to laugh, but then I said, you know what? How many times in your career is somebody going to come to you and say, you know what? We want you to run this. We have enough faith and confidence in you that we believe you can do this. And we're going to help you with we'll help you with the stuff you don't know, but you know what needs to be known to do this job right. How many times is that going to happen? And the answer is it's not, or it very rarely does. And sure, it was a risk. It was a huge risk because you could fail and, do a lousy job or make some really bad mistake. But on the other hand, it was an opportunity. And an opportunity that I knew wouldn't come around again. So I reflected on it. I talked to my wife, and my wife was, we were newly married. My wife thought I was crazy. So part of what had to happen here is that the consultants from the county needed to convince my wife. But we ultimately decided that this was the right thing and we were going to take a chance. And again, it was one of the, I'm humbled to have been asked. And it was obviously career and life altering and shaping because I wouldn't be here today if I had made a different decision all those years ago.
Thank you, Art. I would like to know what's important to you when you evaluate these opportunities that has risks. What are the things that's important to you in just trying to analyze the situation and decide whether or not you should go with this opportunity or not?
Sure, and there are a number of things that you have to consider. First is, what do you want to do? Meaning, you have one life. You have one career. What do you want to do? What do you want to make of that career? How do you want to make a difference? So in the case of accepting the position to run, in this case it was the Nassau University Medical Center, you have to ask yourself, is this what you want to do? In my particular case, I said, I would love to do this job. And the reason why I said that is that, A, it's an executive job, and rarely do you get handed the keys of an institution and say, it's yours. B, the hospital does good work. You treat people who need your help. You treat, particularly a public hospital, you're treating poor people. You're treating people who are vulnerable. You're treating people who are at the fringes of society. These are people who need care more than others need care. And now you have an opportunity to lead an institution that's charged with delivering that care and delivering it well. And so I took that as a real opportunity to make a difference. So you want to ask yourself, where do you want to be in terms of your job and your career? Second, you want to also ask yourself, how do you want to balance your work with your home life? Certain jobs may make more sense at different times in your career. If you're married or you're not married, if you have kids, if you don't have kids, if you're younger, if you're older, you have to factor that in. The third thing I would say is you have to have an honest assessment of can you succeed in the role? And you have to have that conversation with yourself. In this particular case, I was being asked to take on a role I'd never had before in a field that was unfamiliar. So you can reasonably question yourself about whether you're going to be successful. I felt, though, that there were other things that I was bringing to the table that would help me to be successful. I knew how to lead. I knew how to manage. I understood finance. I understood the relationship with the county. I understood, the larger policy questions. I understood the politics of Nassau County, which was really important in ensuring that I would be able to viably run the Nassau University Medical Center. So, you have to have that sort of honest conversation with yourself and have and chart out a pathway for success, which I did. In the case of the Nassau University Medical Center and my leadership there, what I did is I said to myself, you know what? Everyone's assuming that I'm coming to the Nassau University Medical Center with a finance background to just be a finance person, to cut costs wherever I could cut costs, and not focus on the mission of the hospital, not focus on improving quality or improving safety or those sorts of issues. So I said to myself, how I'm going to be successful? I'm going to do the opposite of what everybody expects. I'm going to go to the hospital and I'm going to focus on quality. I'm going to focus on safety. I'm going to focus on the patient experience. And when I knew that I was doing the right thing was maybe 3 or 4 months into my tenure, the vice president for quality and the director for safety for the hospital came to me and they said, we just listened to you present at a town hall. And in the decades that we've worked here, we've never had anyone in the position of CEO talk to this hospital about excellence in quality and in safety and in patient experience. And that being at the core of what it is that we have to deliver to our patients. So we're here to follow you wherever you want to take this hospital. As soon as they told me that, I remember calling my wife and saying, you know what, we're going to be able to do this. We're going to be successful at this. And we were. We were successful.
So from what I just heard, sounded like there were about 3 things that you considered. One was where you want to be at. Number 2 was considering your family and that family situation. Number 3 is seeing where you could fit in and how you could change the systems and where you're at.
Right. What's your pathway to success? Do you see how you can be successful in the role? Can you envision it?
That's great. That's great. And I want to go back to your family life and how you balance between your family life. You know, I'm just amazed as an executive how you are able to balance between being a husband, a parent, and an executive. So what would you tell your younger self now? What advice would you give your younger self on how to be the best spouse, parent, and executive?
So, best spouse, make time for each other. My wife is a Supreme Court justice in New York. Lots of commitments, lots of responsibilities. My job is very challenging. I have lots of commitments, lots of responsibilities. The key is always to make the time for each other and to balance that with the time that you have to spend with your work. I think I've learned that and gotten much better at that over time. If I were advising my younger self, I would say focus on that right out of the box, right away, number one. In terms of being the best possible parent, the advice I would give my younger self is show up. Be present at all of the important events. I made most of them. I missed one. And the one that I missed, my daughter, it was a recital of my daughter's. I still hear about it today, and my daughter just turned 26. Children don't forget. So it's critically important to be present and to make the time to be present and to show up at those events. You have a responsibility at work, but you also have that responsibility at home. And in terms of being the best possible leader, I think that was the third one. Executive. I think what I would tell my younger self is that it's okay not to be the smartest person in the room. I was pretty smart growing up. I got really good grades. I was valedictorian in college. That's all great. But you realize pretty quickly when you get into jobs such as these, where you're running major hospitals, whether it's the Nassau University Medical Center or right now, Mount Sinai Morningside, you realize you're surrounded by a lot of really smart people, some of them smarter than you. And the key is to be okay with that, not to be threatened by that, and to cultivate the intelligence that's around you and draw from it in order to identify the best possible solutions to the problems that you're confronting or to the challenges that you're trying to address. The best leaders are the ones who are comfortable in their own skin and can acknowledge that, you know what, there are smarter people that are sitting here at the table. My job is not to be the smartest person. My job is to be the leader. And if you do the leadership piece right, the key is you want to surround yourself with really, really smart people, because that helps you to inform your leadership and to inform the direction that you're taking your organization.
And Art, I know that you've been proactive in your career in mentoring and coaching others. Why do you think that's important?
I think mentorship, helping people who are coming up, I think these are really, really important things to do. One, because we all have to recognize that yes, any of us who have achieved leadership positions, we're all talented in some way, but we're also really pretty damn lucky. And we got to understand that luck played a role, that fortune played a role, and that it's important when you recognize that to have a sense of humility about the position that you're in, and a sense of responsibility for the next generation of leaders. To reach out, to convey things that you've learned along the way, to lend a helping hand, to open a door, to answer a question, to give a push where necessary, to make a phone call where appropriate. All of these things can help the next generation of leaders. And I really think it's incumbent upon those of us who have achieved professional success to realize that it's not just, we didn't achieve it just because of who we are. Circumstance played a role, fortune played a role, fate played a role, and that, again, engenders humility, and humility really should lead you to reaching out to the next generation and trying to help them to achieve the successes that they want to achieve in their careers.
That's great. Thank you. I know you've been an encouragement to many people, but can you share a time where those that you've encouraged or even mentored was an encouragement to you?
I'm going to answer the question a little bit differently. So in November of 2013, the board at the National University Medical Center elected not to renew my contract. So I had a period of time that I was still there as president and CEO, but I clearly had to find another position. And so I was actively looking, and I received a phone call. And I received a phone call from a gentleman that I hadn't met in 15 years, who was a managing director at Citigroup. And he said, you know, I read about what's going on over there. He says, I'd like to come talk to you. I said, okay. So he comes in, and he has a yellow pad with him. And he's got a number of things scribbled on the yellow pad. And he sits down, and he proceeds to interrogate me a little bit about, you know, so what's going on? What are you thinking about for your next move? And then he references the yellow pad that he had in front of him. He says, you know, I wrote down a number of different ideas for where you could go next. And I stopped them there. And I said, hold on a minute. I said, I just got to ask you, you know, why are you here? You know, we haven't talked to each other in 15 years. And 15 years ago, we didn't even do business together. So I was like, so I don't understand. And he said to me, he said, you know, he said, I've been on Wall Street my entire career. And I've seen countless times where good people have been let go from firms because of the economy or whatever. And what typically happens is everybody runs away at that point, right? Because that's their instinct. He said, so I've said to myself, well, I'm not going to run away. I'm going to reach out to folks like you. And he said, so that's why I'm here. He said, I did some thinking, and there's a number of things I could see you doing next. And you've given me a number of ideas in our conversation, and I want to help you. And two things from that. One, I've internalized that message. So I actually make a point that when, you know, somebody loses a job or somebody's struggling to find a job, that's when I want to try to reach out and see what I can do, because it's the right thing to do. Not because I think somebody's going to help me in return, but because I think it's the right thing to do. And you know, it's ironic that I learned that kind of a lesson from a Wall Street executive, but it's genuinely true. And the second thing is, he was good to his word, because I found out subsequently from multiple people that he was reaching out and calling contacts on my behalf to try to open the door, to try to see if there was a way, an entree in, or a position that was open that would make sense for me to take on. And I'll never forget the phone call that he made, the meeting that we had in my office, and really reflecting on how powerful that encounter has been in shaping how I approach people who are struggling with their careers, or people who have been let go from their particular job for whatever reason. I want to be like my colleague at Citigroup. I want to be that person who goes into the room and tries to help, not the one that runs away.
Thank you, Art. You know, I've actually experienced that from you when I was doing a career change myself. I reached out to you. You spent some time giving me some advice and coaching. You also passed my resume along to human resources from your organization, and I got a surprise call. She brought me in. We had a good conversation, and that really impacted my life, because I knew at that point in time that that's something that I need to do for others too. And I need to care for people. I need to spend time with people, especially during their times of looking at their careers and just seeing where they want to be. So, you know, if I've experienced that, and I want to thank you for that experience.
Thank you. No, I really do think, again, I know that I am fortunate to be in the position that I'm in. And the question then, if you recognize that you're fortunate, what do you do about that? And And the answer is that you approach the fact that you're in that role with humility, and that you realize your responsibility to help lift up the next generation of leaders. Those colleagues who are struggling because they're in between jobs, those contacts on LinkedIn who they can't quite figure out what the next move is. If there's something you can offer and you have the opportunity to do it, you should do it. And that to me is how we build ourselves up as leaders and as professionals, as healthcare administrators.
That's great. And finally, I want to end this time to talk about the diverse, equitable, and inclusive workforce. I think there's two sides of the coin here. From an executive leadership role, it's about building that workplace culture. And it's also building the pipeline. And from the other side of the coin, the diverse candidate, how do they position themselves to better themselves and to improve upon themselves to enter the workforce? So I would love to hear your perspective, and how do we build those cultures up in our workplaces?
No, it's a great and obviously timely question. It is clear to me that the murder of George Floyd really had a seismic impact on the cultures of organizations, big and small, throughout the United States and frankly throughout the world. Because there was a recognition, I think a common recognition, that for all of our verbal pledges to equality and our theoretical commitments to equality, that's just not what was happening in the workplace. We were still seeing boardrooms dominated by people that look like me. We were still seeing leadership positions in major organizations dominated by people that look like me. So the question is, what do you do, and how do you change your culture? First, I think you have to set the tone and the example. All right. So that means that you as a leader have to make the extra effort, if an extra effort is required, but you have to make that effort to be able to recruit top talented people of color for key positions within your organization. Too often what we tell ourselves is, well, we looked and we weren't able to find anybody. Well, that means you didn't look hard enough. There are exceptionally talented people of color who have been exceptionally well trained that can fill every position within a healthcare organization. We just have to do the work to try to find them and recruit them. So you got to walk the walk, you got to talk the talk. You've got to be, as a leader, you've got to be all in, and you've got to do the work of diversifying your workforce and changing your culture to being one which is one which fosters equity and really one which fosters an anti-racist attitude. And by anti-racist, I mean that it's not just that we're not racist, it's when we see something that's racist, we call it out and we do something about it. I think second, you need to have ongoing conversations within your organization. Difficult, challenging, sometimes uncomfortable conversations, but conversations nevertheless with your leadership team, with your middle management team, and with the frontline staff. You need to have these conversations and engage in these difficult discussions, because that's how truth emerges, that's how trust emerges within the organization. So I've had, for example, folks at my hospital here at Mount Sinai Morningside, they've come to me when we've had those sorts of conversations, they've said, one of the things that I was taught at an early age is you don't talk about race at your job. Well, you know what? Now you do. You do, because that's how we make a difference. That's how we change things. That's how we surface assumptions that were otherwise hidden. That's how we challenge each other in a good way. That's how we learn from each other. And then I think the third thing is, that you need to, as a leader in a healthcare organization, you need to make equity not like a sidelight. It's not, well, this is the thing that the DE&I folks do. No, This is central to who we are. So our job as healthcare administrators is to have equity within the workforce. Our job as healthcare administrators is to create an anti-racist organization. Our job as healthcare administrators is to deliver care that is equitable amongst people of different races and backgrounds. And it's our job as healthcare administrators to make sure that our staff, whether it's our physicians or our nurses or our frontline staff, treat everyone that they encounter with the proper respect that they all deserve, regardless of the background that they're coming into our institutions from.
You know, Art, from my perspective, just hearing your story, I could feel the passion when you shared that. And as someone who grew up in an immigrant family, I could appreciate that even more coming from a senior executive like you. So thank you with that. Are there any advice that you would also give to early and mid-careerists who are of diverse backgrounds and how they can change their organizational culture?
Sure. So let me offer a few ideas or thoughts. One, understand that now more and more organizations are increasingly receptive to frank discussions about race, about diversity, about inclusiveness, about equity. So don't be afraid to engage in those discussions or find where those discussions are occurring within your organization. Second, I think it's important to, when you're seeking out organizations, to actually look at are the organizations you're considering working for, are they truly committed to equity? Are they truly committed to anti-racism, or are they just committed on paper? You know, like, so how are they actualizing that commitment? And if these are issues that matter to you, then go seek those organizations where the commitment's not just one on paper, but one that they're really living out each and every day, because that's the kind of organization you're going to want to work for, and that's the kind of organization you're going to want to build your career in. And then I think the last thing would be, even if you're an early or mid-careerist, you can mentor others. If you're a mid-careerist, there's somebody coming behind you. And so serve that role as a mentor for, in this case, people of color who are trying to come up through the ranks as well. Recognize that we all need to put, to put that hand out for those who are coming after us. And in this case, as the ranks of our organizations are getting increasingly diverse, let's tap, the people that because one of the things that I've talked to my team about is the fact that when we recruit diverse candidates for key positions, we can also work with those individuals to identify more people that can come into our organization. We can tap their Rolodexes, to use an ancient term. We can tap their Rolodexes to try to, again, even further diversify the ranks of our key positions in our organization. So if you're a young, early or mid-careerist, you may be tapped by the leadership in the organization to identify other colleagues who might be willing to come work at your particular organization. Be open to that. Leverage the contacts that you have to even further diversify the ranks beyond where they are already.
That's great. So no matter where you are at in your career, there's always opportunities to mentor others and bring others along with you.
Yep, absolutely. Absolutely.
Thank you, Art. It's evident through your stories and words of wisdom today of why you are receiving HLNY's Award of Distinction. I want to thank you for spending the time here today to share your stories with us so that we could be inspired and we could learn from it, and that we could continue to move forward to be better people and to be better leaders. Thank you, Art.
Thank you. Thank you for the kind words. Thank you, HLNY. Thank you all for, again, this award. It's truly humbling, and I hope that I continue to earn this award each and every year that I continue to be in a leadership position in healthcare.
And I'm sure you will. Congratulations.
Thank you. Thank you.
Hi, Art. Congratulations on your award. It's well-deserved. I just want everyone to know that I met Art at NASA University Medical Center about 10 years ago. And a quick story on how we met the first time. I walked across the street to a pizza place with one of my colleagues to have lunch, and we see Art walk in. And I said to my colleague, I said, wouldn't it be funny if he sat with us? You know, we don't know him, he's the new president, and everyone was nervous. And guess what happened? Art came over to us and said, do you mind if I sit with you guys? And he sat with us and we got to know him. And just that's the type of guy Art is. Approachable, dependable, bright, and just a good guy. And we miss him here dearly.
Art, from the time you were my professor at HLNY University, I knew you were destined for great things. So it's no surprise to me that you've been selected as this year's HLNY Award of Distinction recipient. You've been a great leader, a wonderful mentor, and an awesome sponsor.
Hi Art, congratulations on winning the 2021 Award of Distinction. When I heard that you were being honored this year, I was so excited, as I can't think of anyone more deserving of this honor than you. You are truly an amazing, supportive, visionary, and transformational leader, and I want to thank you for all the guidance and support that you've given me over the last few years working for you at Mount Sinai Morningside. It has truly been a pleasure to meet you, and even more of a pleasure working with you. So cheers to continued success, and wishing you all the best. Congratulations.
Art, my personal thanks and congratulations. I am a direct beneficiary of your mentorship and guidance in my healthcare career. I appreciate you for sharing of yourself and your knowledge so openly and willingly with everyone that you work with. And you also have an amazing ability to collect and connect fantastic people. I, for one, am honored to have been collected along the way. You may wonder sometimes if your words have any impact, and I wanted to offer proof of that. It's my AG Wow's words of wisdom, and I refer to them quite often. Thanks again for everything that you've done for me and all that know you and appreciate you. Try to enjoy this as much as your modesty will allow.
Art, congratulations. This is so well deserved. You've been, had 3 major roles in my life. First as my professor, second as my boss, and third, more importantly, as my friend. You've had influence and impact on my career and on my life personally. You allowed me to change career by taking a chance and hiring me the first time, and having the wisdom to hire me a second time as well. So thank you for that. Thank you for your work in trying to figure out ways that we can transform healthcare, not only incrementally through continuous improvement, but in big, bold strokes, and pushing us and inspiring us to really think in those ways to try to find those breakthrough transformation efforts. The healthcare leaders of New York have a wonderful role model in you. I wish you a wonderful evening, and I wish for the healthcare leaders of New York to be inspired by Art in the way that I have been as well.
This is the moment of recognition for all the great work that you have done expanding great healthcare to those most in need. Celebrate and hold on to this moment. It will give you strength for the future.
Art, congratulations on winning this amazing award. It's incredibly well deserved. And I'm grateful for your mentorship and your friendship and for your incredible contributions to our health system and also to the field of healthcare. And I wish you all the best.
I've known you now for several years, and in being part of your professional life, I've seen how incredible you are as a leader, utilizing your role to advocate for populations of patients that don't always have a voice. You're an amazing teacher and mentor, leading and showing the way for so many of us who want to follow in your steps. And no matter how busy you are, you've never hesitated to give of your time, either to be a mentor in our programs or to share your career journey with our teams. And I've also been able to get to know you personally. You rescued a dog from us, Bruno. And even though Bruno has not been easy, you've never given up on him. I am truly honored to call you my friend. and I look forward to sharing more stories of Bruno for years to come.
Art, you are an exceptional leader. You teach by leading through example, you walk the talk, you always do the right thing, and you ensure that we all have fun in the process. I am absolutely thrilled to be joining the chorus of people singing your praise today.
Hi, Art. Congrats on your award of distinction. Such an incredible honor and well-deserved. You've been such a major champion of the underserved, and you've been a great mentor to so many colleagues like myself. We all can't thank you enough.
Hey, Art, congratulations on your receipt of the Award of Distinction. Well-deserved, great job. You are an amazing person. Enjoy.
Congratulations, Art, on this amazing award. I know no other colleague that deserves it more. You're thoughtful, you're kind, you're a compassionate leader, and you're an innovator. And I just am very happy for you and want to congratulate you.
It is my honor to congratulate Art on this well-deserved Award of Distinction. As a leader, colleague, and mentor, Art is a role model in encouraging meaningful conversation and constructive debate. His direct and honest approach is at the foundation of his ability to bring out the best thinking and to multiply the intelligence of those around him. Just as important, Art demonstrates a deep caring that extends from a focus on the organization to a concern for the well-being of the individual. I personally am grateful for the opportunity to work with Art, to debate with him, and to learn from him. And I know that I am among the many upon whom Art has had a tremendous impact, as is evidenced by this award and this honor.
Arthur, you're a leader, an innovator, and a guide and mentor to so many. Congratulations on this significant honor. I consider myself so fortunate to consider you as a friend and a colleague. This is wonderful.
Art, congratulations on being this year's HLNY Award of Distinction recipient. There is no one more deserving of this than you. Thank you for your continued mentorship, sponsorship, and leadership.
Art, sincere congratulations on this well-deserved Award of Distinction. I couldn't think of a more worthy recipient. You've been a tremendous asset to the profession and a phenomenal colleague. Look forward to many more years of innovating together. Good work, Art.
I'm honored to have the opportunity today to congratulate Arthur Gianelli for the Healthcare Leaders of New York Award for Distinction. This award is most well-deserved to someone who's proved excellence in healthcare leadership. Your achievement is a testament to dedication and perseverance and is nothing short of incredible. I only know of a few people that can inspire others to greatness, and I'm grateful for your mentorship and leadership to myself and other future healthcare leaders across New York State. I know that this achievement is only one of many the future will bring. Thank you for including me in your journey.
Your leadership continues to be an inspiration for all those whose lives you touch, mine included. Thank you so much for your incredible warmth, your mentorship, and your everlasting friendship and support. It is appreciated. You are an incredible leader, and I'm so grateful to be able to congratulate you for this incredible award.
You have perfected the genuine art of asking others what to do rather than telling others what to do. And to paraphrase you, Art, there is always that occasional brilliance that touches some, but we must focus on the everyday greatness that touches all, and that is what you do every day. Thank you.
Hi, Art. On behalf of the Department of Health Policy and Management here at the Mailman School, I want to congratulate you on winning the Award of Distinction and being one of the real healthcare leaders of New York.
Hi, Art. Congratulations on this well-deserved recognition. It is always a pleasure working with you, and I look forward to continuing to work with you as we improve healthcare together.
I have the honor and privilege of working with Arthur Gianelli every day. I could think of no one more deserving than you, Art. Congratulations on winning the Award of Distinction through HLNY for 2021. I appreciate you. You're a great leader. Thank you for your support of nursing and for your transformational leadership.
Congratulations, Art, on this prestigious award. Not only are you the president of Mount Sinai Morningside and the chief transformational officer, you truly are a transformational leader.
Art, in 3 months, you and I will have worked together for 20 years. I'm speaking from experience. You truly deserve this honor.
Just want to congratulate
Art Gianelli on his Award of Distinction from the Healthcare Leaders of New York.
Here's to many more years of working together, and a hearty congratulations to one of my most favorite people, period.
Thank you so much for being the passionate, humble, and collaborative leader that you are. I'm so grateful to be on this journey with you.
I can't think of anyone more deserving for this award than you.
Thank you, Art, for all you've done to care for the most vulnerable among us. Thank you for all that you've done, and thank you for all that you're going to do.
Congratulations.
Congratulations, Art.
Congratulations.
Congratulations.
Much congratulations.
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 Congratulations, Art.
Congratulations.
Congrats.
Congratulations.
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 Congratulations, Art. It's well deserved. See you on the golf course.